Much attention has been focused on the Ebola outbreak in West Africa, and this has turned the global spotlight away from lifestyle diseases such as obesity and diabetes towards infectious diseases. The increasing urbanisation is helping the spread of infectious disease, particularly in slum areas where the population might not have access to clean water or sanitation. Additionally, the overuse of antibiotics is making it harder to stop the spread. And the problem is particularly acute in those countries where health expenditure is low and the health infrastructure is weak. The three sectors of the economy that are most affected are, first of all, tourism, because an outbreak can put tourists off from visiting the country, or even neighbouring countries, or even the region as a whole. Secondly, businesses that trade across borders, because restrictions can make it difficult or even impossible to import and export. And finally, the service sector as a whole, and this is because an epidemic can put people off crowded spaces, and it can also put off employees dealing with customers. Uncertainty is one of the biggest threats to economic growth, and nothing breeds uncertainty like an epidemic. And this is why the fear factor and the ensuing panic can mean that the economic impact of any crisis far outweighs the physical spread of the disease. This is in the short term. But in the long term, it's very difficult to quantify the effects of an epidemic because much depends on the longevity and the severity of the crisis, and also of the demographic structure and the economic structure of the country or countries involved.